Hello everyone. In this video we are going to learn the functional release treatment technique for the posterior rotator cuff muscle, that is the infraspinatus and the teres minor. Both the muscles are the external rotator of the shoulder joint and can often become problematic and dysfunctional. And when the posterior rotator cuff muscle does not function properly, the shoulder biomechanics is going to be significantly compromised. Therefore, it becomes important for a physiotherapist to regularly assess and treat the posterior rotator cuff muscles for a variety of pain conditions. So let's get started with the practical demonstration for this technique. So to deliver the functional release to the posterior rotator cuff muscle, the patient is going to be in the prone lying position and the therapist is going to stand on the side that needs to be treated. The patient's affected side upper limb is going to be taken into 90 degrees of abduction with the arm resting over the treatment couch and elbow hanging freely in the downward direction. And now from here, the therapist is first going to localize the spine of the scapula and going inferiorly here in this infraspinous region, we are going to locate the infraspinatus muscle. And the same can be confirmed by resisting the external rotation movement of the patient. And we can find the palpable contraction that is occurring in the infraspinatus. Now, since the orientation of the fiber of the infraspinatus is from lateral or from medial to lateral direction, we are going to go perpendicular to the orientation of the fiber to look for the presence of trigger points or taut bands. And once we find and locate a taut band, the therapist is next going to deliver the ischemic compression from the posterior to anterior direction over the trigger point or the taut band. And this can be done using the near hand of the therapist. The thumb is going to be utilized to deliver the ischemic compression force over the trigger region. And while holding this for around 60 to 90 seconds, the therapist can next combine this ischemic compression with the functional release treatment, in which the therapist is going to passively perform the shoulder external rotation and internal rotation movement. And what the therapist's left thumb is doing is, the thumb is only trying to facilitate the shortening of the taut band and the lengthening of the taut band. So here the technique is going to look like this. So internal rotation, we are facilitating the lengthening, and external rotation, we are facilitating the shortening of the taut band that is present in the infraspinatus. Similarly, for the teres minor, the orientation is going to be from the infero-medial to the supero-lateral direction. So again, we are going to palpate for the presence of trigger points and taut bands perpendicular to the muscle fiber. And once we reach the region that is having a trigger point, we are going to again deliver the ischemic compression. And the next technique is going to remain same as that for the infraspinatus, but this time the shortening and lengthening is going to take place parallel to the muscle fiber. And so the technique is going to look like this: external rotation, shortening of the taut band, internal rotation, lengthening of the taut band. So this is going to be the functional release treatment for the teres minor muscle. That's it. I sincerely hope that the information shared in this video is going to be helpful for you all. See you in our next video. Till then, keep learning, keep sharing, and stay connected.